up, guys? It's Andrea. I'm back again with another video. First of all, guys, it feels literally so amazing to be able to sit here and record and like not even have to think about studying. Congratulations to all of you who completed the semester. Those of you, who had a tough semester, whether it was pre-nursing, whether you were in nursing school, regardless, guys, you made it. Honestly, feels super weird. And I knew I was gonna feel this way. Y'all know, at the end of the semester, when you study literally practically every day for the past, 3 or 4 months, and then the time actually comes where you don't have to study, it feels just super, super weird. But anyways, in this video, guys, I am going to be talking about, as you can tell by the title, my clinical experience in the intensive care unit. So this is a quick little semester update. Like I said, I am done. Shocking to say, but I ended up with all A's and B's for the semester. For my clinical, for the ICU, I ended up getting an A in that practicum. So like I said, I'm just gonna go ahead and talk about my experience. Okay, so this was definitely, I feel like, really different. Honestly, both of my clinical experiences for this semester in general are just different compared to all my other clinical experiences. But specifically talking about being in the ICU. So this semester I was actually on a neuro floor, a cardio floor, as well as a stroke floor. And you guys already know, when these patients are in the intensive care unit, this is critical care. So it means, they have a lot more going on versus if you on your average med-surg floor. And so I think that's what really makes this experience, this rotation, a lot different from the others. Because these patients have so much going on, you always, as a student nurse, and I imagine as a nurse, you always have to be on alert because, you never know which direction or which turn your patient's gonna take. Hopefully, it's for the better, but of course, because these patients are in a critical condition, you never know what to expect. And so with that being said, I actually just want to give an example of, by me saying you never know what to expect. So as you guys know, we have to actually do care plans, as I'm sure most of you do as well. So care plans for a patient that we choose. So let me give y'all a little story. So one of my classmates, he actually went to go, so we would normally go a day or two ahead to go pick our patient because our care plans were so long that we needed that extra amount of time just to get the work done. So like I said, we went to the hospital so we could all go pick our patients, and he went to go pick his patient. But by the time he got done getting all the information from his patient, for his patient, from the computer system, his patient had already coded. And so just that fast, from the time we had got there, within maybe an hour or two, the patient had coded. And the nurse had told him, hey, you should probably pick another patient because this patient, isn't gonna make it through the night. So that's what I'm saying. It's really, really, you never know what step is, you know what step is next, but you never know, I guess, which direction your patient may turn to. So it's really, really important, I feel like, especially going in as a nursing student, that you're kind of, for the most part, aware of your patient's condition. That's why I feel like, yes, the care plans can be very, very annoying, but they're also really helpful just to know, what kind of complications could result from your patient's condition. And something else that I really did enjoy from this specific rotation is that I actually got to practice a lot more of my skills. Again, because these patients have so much going on, they need a lot of, lab work. A lot of them are on Foley catheters. They all have Foley, well, not all, but a lot of them have Foley catheters. Me personally, this semester, I got 2 straight cath my first male patient. So that's why I said you really get to practice your skills. And what I really enjoyed is one rotation, I was actually with the charge nurse. So, and I think I talked about this actually in my ICU Get Ready With Me video. I was with the charge nurse. So she made it sure that if there was anything interesting going on, if there was anything that I could do and I was able to do, that I would get it done. You know what I'm saying? So that's what I really, really enjoyed versus being in my psych, which I'll talk about in my next video. Being in my psych clinical, it was a good balance because when you're in psych, which again, like I said, I'll talk about this in that video. When you're in psych, you don't do assessments at all. So it was a good balance between going back and forth between psych and being on the ICU unit, because again, you have to, a lot of these patients need neuro checks. They need head to toe assessments frequently. So it was really, really good just to make sure that I was getting those skills, done. And even I was doing them so much to where it was almost like I had kind of mastered them because, every rotation I got, or even if it wasn't my patient, I was in there doing those specific skills. Another thing that I would like to point out about this rotation, and I don't know if it's because I'm so far along in my program, or because it was an ICU clinical, a lot of the nurses, I remember one in particular, they expect you to know, for the most part, everything that's going on, even if it's not even your patient. That's why I said I remember this one nurse, like it wasn't even my patient, and she was questioning me, this, that, and the next, and she really made me think. And it can be kind of, I don't want to say frustrating, but it can be kind of discouraging. And it was kind of discouraging at first when, she was quizzing me, but at the same time, I was getting stuff right, but then I had no idea what she was talking about. So that's why I was saying it kind of got to a point where it was really discouraging, like, why don't I know this stuff? But then, I was talking to her about that whole situation, and she was like, that kind of comes with experience. So I guess that kind of stood out to me, but that's what I'm saying. I feel like in this specific rotation, and again, maybe because I'm so far along in my program, a lot of the nurses, majority of the nurses, even besides the one that I was talking about, a lot of them would quiz me, okay, well, why are you giving this? Okay, well, what if this happens? What are we gonna do? Or why is this happening in general? What's going on within the body that's allowing this to happen? So just really stay on your P's and Q's, and really just making sure you understand what's actually going on with your patient. Another thing also that I would like to point out, just so you guys, if you are going to be maybe going into ICU clinical soon, you're not taken so off guard. Like I said, because these patients are in critical care, a lot of times the nurses, they're always on go, and sometimes they may forget that they even have you, with them as a student. Don't, like I told you from day one, don't take that type of stuff personal, because of course at the end of the day, the patient is far more important than us following them around. But that is where you need to step in, and everywhere your nurse goes, you need to go. You may feel crazy literally just following around your nurse, and they're not even noticing you. But of course, you want to make sure you're still learning. And if it's getting to the point to where you feel like you're just absolutely not learning anything, there is that possibility of you switching nurses, maybe to someone who's not as busy. I've seen it done before. But just keep that in mind. A lot of these nurses are busy because their patients, do need so much. Don't take it personal if they forget you're following them around. Ooh, something else that I really want to say was definitely a challenge for me was a lot of these patients are on mechanical ventilators, especially when I was on the what floor? I think it was the stroke floor. My last patient actually had a mechanical ventilator, and so you guys can imagine like how that could make an assessment difficult. Getting that subjective data from that patient is impossible. It's, they can't talk. So it's like, how am I supposed to get this information? Who am I supposed to get it from? They don't have a family member in the room. It's not written on the chart. Like, how am I supposed to get the information? So that was definitely a big struggle. And I think how I overcame that, well, I didn't overcome it, but it was just like when I was presenting my patient at post-conference, you let your instructor know the patient was mechanically ventilated. There was nothing I could do as far as, obtaining that subjective data. I guess kind of the last thing that I want to just point out, I didn't say that, I should have said this earlier, but so I only have this rotation. I would have it 3 weeks on, 3 weeks off, 3 weeks on, and then 3 weeks off. And the weeks that I was off, I was in my psych rotation. And when I was on the floor, it was on Wednesdays? I done forgot that fast. Yeah, it was on Wednesdays. So I would have my simulation. The way my semester was set up is when we were in our med-surg to ICU rotation, we would have our simulation from 8 to 5 one day, and then the next day would be our clinical rotation. So I would have my simulation on Tuesdays, and then Wednesday, I would be at the hospital on the floor from, 12 to maybe 7, and then from 7 to around 9, we were in post-conference the whole time. But then within that, 12 to 7 hour time frame, I did get to take a break. So I feel like I really enjoyed that time frame, that specific 12 to 9, because it went by super, super fast. Compared to when I used to do clinical in the morning, I honestly didn't like it, especially because I don't know how to explain it, but when you come on at 6, I don't know if you guys noticed, but when you come on at 6 or 7 or whatever, when they're doing shift change and your nurse is making sure, it's like she's fresh, onto the unit. She's fresh on her shifts. I just feel like things are a little bit more hectic around that time, and I personally feel like it's a little bit harder to have a nursing student following you around at that time of the hour. If you do have the option of choosing a morning clinical or an afternoon clinical, I would choose the afternoon clinical, 1, because I really don't like to get up early, and 2, it honestly goes by a lot faster, as well as 3, having your nurse being already settled in on the unit versus her coming in at 7 and then having to worry about getting making sure she's, all ready for her patients for the day, as well as having to have you, come in fresh as well and follow her around the entire day. And I don't know if this makes sense, but hopefully y'all catch what I'm saying. It's just a lot more, I feel like, easier on everybody when a nursing student comes in maybe at midday versus coming in fresh when the nurse comes in. But all in all, I will say ICU is probably not something right now at the present moment. It's something that I'm not really interested in. I do have a lot of friends that are very interested in it. I'm not saying I didn't love going to the clinicals, but I just know when I went to those labor and delivery clinicals, I was a lot more excited. Not saying that I wasn't excited. Let me choose my words wisely, but I just enjoyed my time more being with women, pregnant women, babies. Like, I just enjoyed that environment more. So guys, that's pretty much it for my clinical experience. Hopefully you guys got a good insight on how my semester went in my ICU rotation. Again, I truly did enjoy it. A lot of my colleagues enjoyed it. We had a great time. We learned a lot of stuff. We got to do a lot of things on the floor. So make sure you guys give this video a thumbs up. Subscribe if you haven't already. Stay up, stay with it, and I'll see you guys in the next video.